Here is my tinnitus journey or tinnitus story. Hello friends, I'm Dr. Maria Morrison, audiologist. I'm your expert in hearing healthcare. I am also a tinnitus specialist. And the first time I ever experienced tinnitus was when I was actually learning how to treat it. I had flown to Maryland to be taught by the amazing Jasterboffs on how to do tinnitus retraining therapy. It's a week-long course. It was a Wednesday, it was after lunch, and then all of a sudden I started to hear tinnitus. I started to hear a ee, and I thought, oh, this is it. This is what I'm learning how to treat. Now, I think because I had such a wealth of knowledge on tinnitus, for me, it wasn't really bothersome at first. I have two kids at the time. I had two small kids, now they're older, but when I had a stressful day, if they were kind of pushing my buttons, so to speak, is when my tinnitus would be bothersome. So at night, I would use a sound machine just to kind of keep some sound in the environment so that my mind was distracted and wasn't focused on my tinnitus. For the most part now, I really don't notice it unless, of course, I'm thinking about it or if I'm with a patient and I'm helping them with their tinnitus and I'm kind of going over my story, my journey. That's when I start to notice it. But otherwise, it's not impactful in any way. I no longer use a sound machine at night. I don't really think about it much, except when people ask me about it. I do believe that my experience kind of further reinforces the idea that we all have tinnitus or tinnitus. It's in the subconscious part of our brain, and something forces it to come to the conscious part. So for me, it was learning how to treat it. For a patient of mine, it was simply talking on the phone to his brother, and his brother is significantly impacted by tinnitus. And so when he hung up the phone on his brother, that's when my patient started to hear tinnitus. For others, it could be going through a stressful event, maybe losing a loved one or going through a divorce. It could be an untreated hearing loss. It could be noise damage to your ears. There are so many causes of tinnitus. And I think it's important for patients to understand 95% of the time, it's not a big deal. It's nothing that you need to worry about. But because about 5% of patients, there is a medical cause, you should get it evaluated. You can see someone like myself. I'm a tinnitus specialist. You can go to an ear, nose, and throat physician. You just want to make sure that there's no medical cause for the tinnitus, because if there is, we want to take care of it, right? And then for those that have it and aren't bothered by it, perfect. That's exactly where we want it to be. But if you are impacted by your tinnitus, meaning it's bothersome in some way, maybe you're having difficulty sleeping at night or trouble concentrating or just getting your mind off of it, there are strategies to help. Please seek out a tinnitus specialist. If you need help finding one in your area, leave me a message in a comment, or you can send me a private message. Let me know where you're at, and I will do my best to try to help find someone for you. I hope this was helpful, friends. Have a wonderful day.